Hey everybody, this is Dr. Khadisha, your board certified emergency medicine physician and entertainment industry mobile MD. My emergency and concierge care help people feel better, be safer, and better prepared for emergent medical situations. And I'm actually at work now, and I saw that in the news that John Singleton, award-winning director of Boys in the Hood, only 51 years old, I believe, suffered a stroke today. And if someone like him can have a stroke, we need that to be a warning and a lesson to us all. And the first thing is that stroke is the 5th leading cause of death in the U.S., and it's a leading cause of disability. Hi, Tate. Thanks for coming in. Sorry. So this might be a little dry, but it's just that, someone really dear to our community, John Singleton, had a stroke. So I just wanted to make sure that we all, do a little refresher on what stroke is, what the risk factors are, and what you need to do if you or someone that you care about, or just anyone, is exhibiting symptoms of a stroke. Hi, Dr. Dietrich. Thanks for coming in. So I'm trying to broadcast from Instagram and Facebook at the same time. So what is stroke? Stroke is a disease that affects the arteries. It affects the arteries leading to the brain and that reside in the brain. And there are 2 types of strokes. One is the ischemic stroke, which is about over 80% of strokes, and that occurs when a blood clot blocks a blood vessel. And then there's the hemorrhagic stroke, in which a weak blood vessel ruptures or bursts, leaking or just releasing blood into the brain tissue. And when that happens, the part of the brain that needs blood from that vessel could possibly die. So again, 80% of strokes are ischemic. So, and based on the part of the brain that dies, we could lose various body functions. It could be the sensation or strength of any body part based on what region of that brain is compromised. We could lose coordination. We could lose coordination for things like balance, swallowing even, eyesight, even breathing based on where this stroke occurs. So, for example, if you have a stroke at the back of your brain, your vision may be affected. If you have a stroke in the brainstem of your brain, it can affect both sides of your body, and it could make a person unable to speak or make any movements beyond below the neck, and that's called like a locked-in syndrome. So brainstem strokes are just really bad. So like I was saying, it depends on the location of the stroke. And what is a mini stroke? People use that term a lot. A mini stroke is otherwise known as a transient ischemic attack, which involves usually smaller vessels, and it's a more temporary disruption in blood flow to a part of the brain. The stroke symptoms are milder and often have no lasting damage, but they can increase one's risk for an actual stroke by almost 10 times. So, and yes, Dr. Dietrich, like any part of your body function can be affected, including bowel and bladder function can be affected. So that's a mini stroke. A mini stroke is a TIA, a transient ischemic attack. And what are the risk factors for stroke? Age, and I should say this, there's 2 kinds of risk factors. They're the kind that you can control, and then they're the kind that you cannot control. So the first one is your age. Age over 65, once you get over 65, your risk increases. But Mr. Singleton, I believe, is just 51 years old, in his early 50s. Race. Mr. Singleton is African American. African Americans have a much higher risk of death from stroke than Caucasians. And hopefully that will not happen. Most people do survive strokes. You know, there are millions of stroke survivors out here in the U.S., but we just have to know as African Americans, we have a higher risk of death from stroke. Family history. Grandparents or immediate family members who've had strokes under the age of 65. You know, if you have that in your family, then you're at increased risk. And then there's also, you know, other genetic disorders that can block blood flow to the brain. Those can increase your risk for stroke. Gender. Believe it or not, women have more strokes. And why is that? Well, for one thing, women live longer. More women make it to 65. Pregnancy. Pregnancy causes a state in which we're more prone to create blood clots. And like I said, most strokes occur due to a blood clot blocking blood flow to the brain. A history of preeclampsia or eclampsia and gestational diabetes. So more pregnancy-related conditions can increase the risk of stroke. Oral contraceptive use can increase the risk of stroke. Using oral contraceptives put us at more risk for creating clots as well, and especially if you're smoking, that increases your risk even more. If you smoke while you're using birth control pills, you really increase your risk of blood clots, and that could be deep DVTs, the clots in the deep veins of the leg that can travel to the lung and cause PEs, heart attacks, and strokes. So if you're on birth control, stop smoking. And another risk factor that you can't control is sickle cell disease. And this genetic disorder affects African American and Hispanic children, and it causes red blood cells to take on a crescent-like shape and stick to blood vessel walls, which can block arteries. This is one way by which children and young people can have strokes. So people with sickle cell disease, please work with your doctor to prevent those flare-ups, the sickle cell crises, so that you can reduce your risk factor of strokes. Hi, Gino. Thanks for coming in. Thank you so much for checking in. So what are the symptoms of a stroke? Okay, there's an acronym that we need you to learn, that we doctors need you to learn, and it's the FAST acronym. FAST. F is for facial numbness or drooping. A is for arm weakness, numbness, or heaviness. Say if your arm drifts downward when you're trying to raise it above your head. S is speech. Is your speech slurred? Okay, if you think that your loved one or coworker or that person's speech is slurred, ask them to repeat some simple sentences. And T is time to call 911. If you have any of the previous three, call 911. If you have any doubt, call 911. Because a transient ischemic attack, while it might be temporary, that's still a medical emergency. And sometimes all a TIA the only sign that you could have of that is loss of eyesight in one eye. I had a dentist one time who came in saying that she lost sight in one eye for about 30 seconds. And 30 seconds is a long time to lose eyesight. And my nurse didn't believe it. My nurse thought that she was full of it, and why is she in here talking about this? And I told her, I said, a stroke could present any way, just like Dr. Dietrich said. You can lose bowel or bladder function due to a stroke, and sometimes TIAs and true strokes can present with the loss of sight in one eye. And we transferred her to the hospital, and she was having a stroke. So you can't blow things off. So additional symptoms to the facial numbness or drooping, arm weakness, or slurred speech, additional symptoms to that are sudden. sudden numbness of the face, arm, leg, especially on one side of the body, sudden confusion, trouble speaking or understanding, sudden trouble seeing, like I said, in one or both eyes, trouble walking, dizziness, loss of balance, or coordination. So, they might still be standing, but, they couldn't hold their purse any longer. And severe headache with no known cause. Now, we could go more into this, about treatments and rehab and things like that, but the first thing that we need to do is make sure that we control and control our risk factors for stroke. So things that you can control. So risk factors that you can control. What are those? Okay, so controlling your high blood pressure. If you have high blood pressure, just stopping. As my coach, Dr. Tanya Lowe, says, stop stopping. So stop stopping taking your meds. Take your meds. Take your darn high blood pressure meds. I know there might be side effects. You might not feel good, but don't you feel bad when your blood pressure is out of control too? Yes, and hypertension is one of the leading risk factors for stroke. So control that. Know your numbers and get control of that. Okay? Now, how does high blood pressure lead to a stroke? Maybe folks need to know more about the connection between high blood pressure and stroke. When you have prolonged, uncontrolled high blood pressure, the blood vessels become the walls become thick and muscular, and it's harder for your heart to pump blood through those thick muscular vessels. And it can also compromise and ultimately block blood flow. And it is a leading cause of stroke for that reason, and it's the most significant controllable risk factors. So know your numbers, keep them low. The American Heart Association now wants people to keep them below 120/80. Smoking. Number 2, nicotine and carbon monoxide. Yes, carbon monoxide from cigarette smoke damages the cardiovascular system. And when done with taking oral contraceptives, again, the risk is even greater. So this is another reason why we say stop smoking. Smoking, of course, it leads to cancer, heart disease, but it also increases your risk for stroke. So imagine that you're smoking and you're not taking your blood pressure medication. Imagine that. And imagine what risk factors you're creating for yourself as far as heart disease and stroke. Diabetes, another independent risk factor for stroke. It can damage the blood vessels as well as the nerves, and this is how many people lose eyesight, develop erectile dysfunction. Some guys only care about that. Erectile dysfunction can be caused by diabetes, can be a side effect of uncontrolled diabetes, and you can end up having toes, feet, and whole legs amputated. And even when treated, diabetes is still a risk factor for stroke. It compromises circulation to vital organs. Hi, Claudine. Thanks for coming in. We're talking about stroke today since Director of Boys in the Hood, John Singleton, had a stroke. And again, I'm Dr. Kadisha, your board-certified emergency medicine physician. Hey there, Dr. Charlotte. Thank you for coming in. So that's diabetes. Next one, diet. Diets high in saturated fat, trans fat, and cholesterol raise blood cholesterol levels. And if you want to ever see what cholesterol or eating fatty foods looks like in the blood, ask a friend that works in the lab or ask a friend who's a phlebotomist or something like that. Back in the day, I used to be a phlebotomist, and we would get blood samples from people after lunchtime, after they ate burgers and pizza and stuff like that. And we would spin the blood down in a centrifuge, and you'd separate the red blood cells from the serum, which is the liquid, kind of clear part of the blood. And after we spun the blood down in the centrifuge, people who had fatty foods, instead of that serum being nice and clear and golden, things like that, it was very cloudy. It looked like someone had dumped a spoon of Crisco into the serum. And our body is normally pretty good at clearing away the fat from blood, but if we expose our body to, a high fat, high cholesterol diet over and over and over again, that stuff has to go somewhere, and it goes to our blood vessels. Again, compromising blood flow, increasing the chance for a clot, increasing the risk of a stroke or a heart attack. So avoid saturated fats, diets high in trans fat and cholesterol. And then another risk factor that we can control is physical activity. Aim for 150 minutes a week. That's like, an hour, or like say 30 minutes 5 days a week, or maybe you could do like an hour 3 days a week, something like that. Either way, you don't have to pay attention to the numbers, just move more, sit less. And if you have a loved one who has atrial fibrillation, and I'm coming across a lot of people who have significant chronic illnesses, but they don't take their medication for one reason or another. Atrial fibrillation is a heart condition in which the heart does not beat efficiently all the time. And because the heart doesn't beat efficiently to keep the blood moving in a regular rhythmic fashion, the blood can kind of sit in the chambers of the heart and stagnate, and then that's when blood clots can form. Blood clots that can eventually leave the heart. They can cause heart attacks if they go into a vessel that feeds the heart, and they can cause strokes if they make it to a vessel that feeds the brain. So again, have a regular relationship with your primary care doctor. Keep that under control. Also, sleep apnea. If you have sleep apnea has been shown to be related to atrial fibrillation as well. So those are some things to note as far as maybe controlling or reducing your risk factor for stroke. Okay, we can talk about treatment and all that later, but I think right now, especially on a Saturday night, the Saturday before Easter, I'll just keep it short. If you want to, discuss it more, let me know in the comments. But we've got to know how to recognize stroke and what our risk factors are and how to control them. So I'm Dr. Khadisha. I'm your board certified emergency medicine physician and Amazon best-selling author of the book, Help Us Help You in the Emergency Room. It's what an ER doctor would tell you if she only had the time. I turned in my final corrections yesterday, so the book should be available in, they said, like 7 to 10 business days. So maybe not next week, but the following week. Follow me on all social media at Dr. Khadisha MD. That's DrKadisha MD on Facebook, Instagram, and Twitter. And I want to thank you so much for taking the time out. I'm sure you'll hear more about this story about John Singleton and stroke, and at least you'll know what you need to know as far as the risk factors and symptoms to look for and recognize and address in you and or a loved one. So please comment, if you will, in the comment section. Let me know of other topics that you might want to discuss, and I'll talk with you soon. Happy Easter. Bye.